completely crazy. So anyway, I want to share. So anybody out there who thinks they can't take hormones, again, I think you caught yourself, um, uh, Sandra, and I love you. This is sweet because you made a point that taking hormones, people just jump to, I can't take hormones. So there is this narrative out there that if you have any risk factors at all, you can't take hormones, right? But there are so many different kinds of hormones. There's thyroid, there's insulin, there's peptides, there's tons of hormones. There's progesterone, DHEA, testosterone. And I will tell you, just let's start this conversation by saying, if you think that you can't take estrogen, you can at least take testosterone in a topical form safely. I'm very passionate about that. And my patients and my people, hi Elaine, my people that are my tribe know how I feel about this, right? But there is no reason why anybody who's still scared until they get to know me and they get to know this science that you can't take testosterone. So I want to just kind of start out for anybody who might have to bounce that we have a test kit that we can mail you and you can check your testosterone levels. So even if you don't feel comfortable with estrogen yet, right? Because that's what everybody's scared of is estrogen. You might be a candidate for testosterone. So I'm very passionate about that, especially when it comes to muscle. And we think about guys and testosterone because they have more muscle mass. And it is absolutely true. So, and we are actually running a special this month for only $119. So you can get this. It comes to your house. It's a saliva test. You just spit in the tube, basically, super easy. Yay, Alexis, you got it today. Oh, I'm so excited. I'm just giddy. I love it. And then you just send it in. There's a mailer and everything, so it's free to mail it back in. And so, yeah, and then what happens is all included, we have our hormone experts get on the phone with you, and then we get you on some bioidentical hormones. And so, yeah, Elaine, it is just one tube. We do cortisol testing too, but we took out the other 3 tubes that do the serial cortisol testing. So there should be an insert in there that tells you that, make sure you read all the directions in there, but there should be an insert that tells you what you need basically in there. So we can do later, we can do cortisol testing, but we like to start simple with people. So yeah, so anyway, send that in. Oh, you're so welcome. So we do get that question sometimes because our lab only has one kit. So yeah, so we take the other 3 tubes out because we've had so many people just spit in all those tubes. It's hard enough to spit in one tube. You don't think about it, but getting all that saliva is a little bit tricky. So yes, so it's only $119 this month to do the test. And whether you are scared of hormones or not, it's still good to know what your levels are. And that just gives you your power. And doctors who say that you don't need to test your hormones, like you would not do thyroid treatment if you didn't check levels. And so estrogen, progesterone, testosterone are just other hormones. So why wouldn't you want to know that? So I'm going to tell you the main reason why the medical community at large doesn't test hormones, because they know after menopause, they're going to be zero. And so like if you are a doctor who is stuck in an old lie, they're not going to put you on hormones. So why check levels? That's why they don't check. And if you look on the labs, a regular, like you go to Quest Labs or whatever, it'll say actually like 0 is normal after menopause. That's not, it might be normal to not have any hormones after menopause, but that's not okay, right? That's not optimal for you. And if you want the hormones of a 30-year-old to protect you, because 30-year-olds don't normally have heart attacks, which is the number 1 killer of women over the age of 50. 30-year-olds don't have breast cancer usually. I mean, it happens more recently just because the messed up food supply and all the chemicals and stuff. But for the most part, young women don't, and menopausal women do, right? So it's actually a protective benefit. So we are being lied to out there that estrogen is dangerous because estrogen is actually protective. Oh my gosh, 4th grade in 2024. My vitamin D is 9 and I'm 47. Oh my gosh, girl, you have to get on vitamin D. That's terrifying. I'm getting a little hoarse just talking. My son made me some tea. So you guys know I'm a tea drinker. So, okay, and we're back. So vitamin D helps put calcium into the bones to prevent fractures. But vitamin D, actually, I'm so glad you said that. Vitamin D actually helps regulate how much testosterone gets into the muscle, into the bone, into all the cells. So we call it like an Uber or like a taxi. Vitamin D increases something called SHBG, and it actually helps carry the testosterone into the tissues that it needs to be in. So you can have a total testosterone that's normal, but a low cellular free available testosterone if your vitamin D is low. So I usually recommend about 10,000 IU a day, and sometimes I do prescription vitamin D as well. If somebody needs real high dose. My whole fourth grade teacher team is like this. We're struggling. Thank you. Yeah, I mean, there's genetic reasons why people can't convert their vitamin D, and just a little nerdy science with that. So people tell me oftentimes, well, number one, they tell me they drink milk. You cannot get enough vitamin D from milk. That was a big marketing lie. I'll just tell you that. Milk is basically just sugar water. You lose all the enzymes, all the antibodies when they pasteurize it. So it's just sugar water. And I mean, it's microdosing vitamin D. That was just a marketing ploy, basically. So sunlight converts something called D1 into D2, which goes through your kidneys, and then D3 goes through your liver for its final conversion. That's why we buy D3. And so if you have a genetic conversion problem, and a lot of people do, you can't convert through the skin. So it doesn't matter. You could bake in the sun for 24 hours a day. I mean, and you're not going to convert. So that's when we see really low levels, like 9. And also, vitamin D regulates your immune system so that you don't get sick. And vitamin D actually regulates your mood too. So people who get depressed in the winter, the seasonal affective disorder, vitamin D can regulate that too. One of my colleague friends actually told me the other day that once a week he hands out 50,000 IUs of vitamin D to his staff, and he's got a lot of staff. He's got 2 clinics, and I don't know how many patients he has, or how many staff he has. But it's crazy because I take so many supplements, and the girls in my office are sick frequently, and I mean, they see me, I preach every day to them, and they're like, "Oh, I forgot." Like, you can't forget your health, right? I hear that all the time. Patients tell me, "Oh, I forget to take my vitamins." And it's like, you cannot forget your health, and you cannot get everything you need from your food supply. And you're being lied to. They're telling you got vitamin D in your milk. And that's clown world, right? I always say clown world. So vitamin D is super important. I won't harp on that anymore. But so let's get into talking about estrogen here, because I don't want to miss my preaching. Preach it, sister, before we get into everything, because estrogen is very important in this conversation, and so is testosterone. But okay, so I have disregarded this up here. I kind of feel like Wizard of Oz, don't look behind the curtain. Just ignore this for a minute. And when people say don't look, you're like, you want to look all the more, right? Okay, but try to focus right here for a minute. I'm going to share your profile on my personal. Oh, thank you. Incredible. Thank you. Oh, MTHFR. Oh my gosh, that is fascinating. So what I was talking about, the vitamin D, that's a VDR alteration. So she's talking about something called MTHFR. And it sounds like a dirty word, I know. And some night I'm going to do a whole thing on methylation. And I do have, if you go to my link in bio, I have this thing called a link tree. And I wrote a book on MTHFR and methylation issues, liver issues is what we're talking about. And liver health has everything to do with muscle too. So we're going to get to that. But that genetic alteration, the vitamin D alteration you can't convert is called VDR. MTHFR is the methylation issue. So totally fascinating. And a lot of women who have, like, some people say, well, why do some people have so much trouble with menopause and some women don't have as much trouble? Now, we all go through ovarian failure, 100% of us, but some people struggle more because of our liver health and our ability to what's called methylate or clear toxins out. So, and some women, like, that whole thing, like, as you start aging and you're like aging is just hormone decline. That's all it is. But like, can't drink wine anymore. Has that happened to any of you guys, where like your sensitivity or your chemical sensitivity to anesthesia or different smells or, alcohol, Yeah, so see, it's a thing. So your liver is probably more sensitive because you have those methylation issues. So, and anyway, in our link tree, I have tons of freebies and information. So go get that stuff. Go check it out. Just it's not got everything, but it's got a lot. So go do that. But yeah, so we also have I just added this. So I have the reason I said that was because we have a shop link on that link tree now. And all of my supplements are on there. I'm very passionate about supplements. Clearly, I take a handful every day. So I would not take anything that I'm not totally passionate about and behind. So, yeah. So if you go to the shop link, you'll see all my stuff. So, yeah. Okay. So, fulvic acid. Yeah. I mean, there's so many supplements. I like to do genetic testing just so you can actually see what your defects potentially are and what you might need. So, but there's so many, I used to like, well, I still nerdy research and science and stuff all the time. But like I would read something and then I go get get that supplement, and then it would be like, oh, I'd read something and then I go get that supplement. So, you kind of get to the point where your cabinet is full. So I like to focus on the main things, your vitamin D, your methylfolates, your all those things. So um Dora says, how can you see me? You can see me. See me now. So I am in Arkansas, in Northwest Arkansas. So you have to be an Arkansas resident to actually come to my office to see me. But we have an online program and my link is in bio. So if you want to go there, it is nationwide. And so you can go there and the first thing we like to start with is testing because I want people to know that it really is their hormones. I really want them to see that because to have you come into our program and not know what your levels are, you're still kind of always in the back of your head, well, is it my hormones? Because you've been so taught to think, that it's not, or you're gaslighted to think, oh, you just need this sleeping pill or this antidepressant. And so I totally believe that you should know what your levels are first. And then once you do that, then we have you talk to one of our hormone experts and we are nationwide with that. And so then basically the start is we get you on bioidentical creams first, and then we also can look at other testing. So, but one of the things I was going to say in my link tree to my shop page, there is actually genetic testing that you can do on there. So if you want to know about your methylation or your vitamin D status, super cool. Leaving the live to go sign up. Oh, don't leave. You can do that afterward. Don't leave me. No, you totally can. You do if you need to bounce. That's totally okay. So I'm going to go back to the drawing board. Oh, Adora girl, maybe watch this real quick because this is cool. Okay, so hormones, right? Okay, so let's say this is estrogen, progesterone, testosterone. These are okay. These are your ovarian hormones. Okay, so that's estrogen, progesterone, testosterone, DHEA, pregnenolone, all of the hormones that your ovaries make. So I want to start with saying that you are born with all the eggs you are ever going to have in your ovaries. And once you lose those eggs, you lose about 30% of those eggs by the time you're in your mid 20s. And that's why they tell you you shouldn't get pregnant like in your older years past like 40, because your eggs are starting to like, I kind of think of it, like when you crack an old egg that's been like in your fridge for a while and it's almost like past its expiration date and you're thinking, oh, it'll probably be okay. And you crack it and it's got a bunch of brown spots in it. So I'm like, oh, that's probably not okay. And then you pitch it. So our eggs get older. Well, what happens is we literally run out of eggs. And why do we have eggs? Because just like chicken, we mammals have babies, right? So if you pop out an egg every month, that's called ovulation. And that's the mid part of your cycle. And then once we get and 100% of women go through this. Once we get to age 50, here's what happens. Okay, so these are all our ovarian hormones, and this is birth. And so our hormones on this axis start climbing, and then we have menstrual cycles, and then we might have babies, and then you might have abnormal cycles or, just whatever's going on. And now I'm going to draw this right here as we're going to put age 50. So this is birth to 100 if you want to live to be 100. If you don't have hormones, you probably don't. You're probably going to be miserable. So here's age 50, which is the average age that women go through menopause. I did it on my 50th birthday. This was nuts. I mean, I was like getting ready to go to my birthday party that like in my house, but I was in my bedroom. I started like having this drenching hot flash. I was crying. I was like, I've not done anything with my life. I'm such a failure. And it was just like the depression and the anxiety and the mood swings. It was like, okay, God, I get it. You're showing me what women experience to the exaggerated degree so that I can understand this. But okay, so these are your hormones here. And then what happens is you are literally running out of eggs. So you're depleting your basket, and about in perimenopause, you start losing like all your eggs. And then here in perimenopause, your hormones get super crazy, and you've got estrogen spurting out and progesterone. And then all of a sudden, one day you wake up and you are completely flatlined on your hormones. And this is how we're expected to live till we're 100. That is nuts. And everything we think of hot flashes, but it's weight gain, it's fatigue, it's your skin drying up, it's incontinence, it's mood changes, it's just a million things, what we call aging, everything you see in the nursing home, incontinence, muscle loss, all the things. That's what we're dealing with here. And the problem is why the end your hormones go rogue. They go rogue because your ovaries are literally done. If you do an ultrasound on a woman out here 10 to 15 years out from menopause, the radiologist will actually read the ultrasound as ovaries non-detectable. They're done with eggs. The hormone feedback is done, and you are in ovarian failure. And that's the term we should use because menopause, by definition, is just a year without periods. And nobody cares about that. Who wants periods? I don't want periods. I mean, I'm done with periods, right? That's just the definition. And that is all the training that doctors get in med school. Trust me, I was there. Is menopause is a year without periods, done. Okay. And then, we move on. And then there's pharma that says, okay, sleeping pills, antidepressants, blah, blah, blah. That's how you treat it. That's the training that doctors get for menopause. And that's it, right? And that is crazy because what we're dealing with is ovarian failure. If you had your thyroid removed or your thyroid failed, they would not tell you that you don't need testing for that. They would not tell you that you can't have thyroid hormone. And yet doctors tell you that estrogen causes cancer, or they say hormones cause cancer, right? So then you have to say, well, which hormone? Well, okay, let's say estrogen. Well, which estrogen? Well, there's 3 different kinds of estrogen, and then there's 25 metabolites of estrogen. And yes, synthetic estrogens can cause problems like blood clots. That's why you get blood clots and heart attacks and breast cancer on synthetic hormones. So when I say hormones, trust me, I'm talking about bioidentical, non-digestive route, right? So patches or creams or troches or whatever the case may be. And cancer. So estrogen is actually protective against cancer. And that's why women out here have more of a chance of getting cancer than girls here. And doctors put girls as young as 9 years old on birth control, which is synthetic high dose hormones. And they never say these are going to cause cancer. And even if a 9-year-old has a mom or a grandma who had cancer, they're never going to say, oh, did your mom or grandma have cancer? You're at high risk. You can't have this synthetic high dose birth control. And the difference between a natural organic estrogen, progesterone, testosterone, whatever, is the difference I always say between a strawberry and a strawberry candy. Your body knows how to, does not know how to process a strawberry candy other than give you diabetes eventually if you had enough strawberry candy, right? So it's not natural to us. Our body doesn't know what to do with it. So I'm talking about what we call bioidentical or organic hormones, right? Okay, so there was a study done in 2002, and before the study, 60% of women were on hormones, and that study was done to prove that estrogen prevents heart attacks. And it did prove that. But the news came out and said it didn't prove that. And that was a lie. So when I say lie, I'm talking all out lie. Go research it. Don't take my word for it. I promise. Go look. Don't take my word for it. and I've done a lot of research about this, trust me, because I love you guys and I would never, the Hippocratic Oath is do no harm. So, yeah, so go research it. But this study actually did prove that estrogen prevents heart attacks because estrogen actually helps feed and increase oxygen flow, which is what I'm going to talk about muscle here. But it decreases your risk of cancer if it's balanced with progesterone. So, yes, if somebody's synthetic high dose estrogen and don't give them progesterone, you can stimulate breast tissue, which can then go into tumors and potentially cancer. So it has to be done right, but doctors should be being taught this in med school because women are suffering. And if you're a woman who's suffering, put in the comments. I mean, let's just share. I don't give your private information, but you'll see how many women are suffering. But in 2002, when that study came out, what they did was they took women 15 years out from menopause, which is where it comes when women ask me, am I too old for hormones? That was part of that study because what happened was they put women who were 65 years and older on hormones. They did not have the protective effect here. And then they put them on synthetic high dose hormones without progesterone. And they did start having problems. But your risk of breast cancer out here, whether you're on hormones or not, is astronomical. If you haven't had the benefit of hormones. So 1 in 8 is really what the risk out here of breast cancer is out here. So whether you do anything or not, you could even argue, I'm miserable. I'm drenched in hot flashes. I'm gaining weight. I see women gain 5 to 15 pounds a year after they go through menopause. Ovarian failure, because that's what we have to change. This is what this is, ovarian failure. Menopause is a term that shouldn't even matter. And I think of it as hormone depletion syndrome. That's what your problem is. And weight gain, night sweats, hot flashes, incontinence, that are symptoms of ovarian failure or hormone depletion syndrome. Okay, so I'm done with my rant. I went a little longer on that than I meant to, but so that study was completely flawed. And the problem is, before that study in 2001, almost 6 million were on hormone therapy. And now, 2024, we're talking like over 20 years out, 5% of women are on hormones because they scared the crap out of people and they lied. They just straight up lied. The news told people that 1 in 4 women will get breast cancer. And nobody ever said or retracted that, or, it was a lie. It was an absolute lie. So if that's what you believe, then, you have to question everything, right? And you have to look at where the agenda lies. Okay. So all that said, we're going to jump into muscle. So if you have any questions or comments, and again, if I don't see them, please bring them back around. If you like this content, please share it with a friend. And it really helps. There's a thing where you tap on there. I know that looks weird. I'm going at you like that, but it sends hearts and it tells the algorithm that this content is helpful. And I am here every single night at 7 o'clock because I love you guys and I want to share and I want to tell you the truth. And I'm tired of people being lied to, and I'm super passionate and I'm preaching it, sister. And I get mad. And so please just, share the information. So come back every night at 7. I'm even going to be here Christmas Eve. So if you like this content, and I love to share things that a lot of people don't know. So just started HRT because my estrogen is very low due to Lupron. My ovaries are in failure. And that's what happens when you go on Lupron, which is sorry, I want to say stupid. The craziest thing that doctors do is when you have endometriosis or PCOS or fibroids, they just give you Lupron and shut down everything, right? And it's like a little natural progesterone would fix that. But okay, clown world. I'm going to stop now. Okay, so I'm going to talk about muscle now. Okay, estrogen actually helps muscle protein synthesis. That's right. Estrogen actually helps you synthesize muscle. So you can see if you're here, you're not going to make new muscle cells, right? End of story. And the rate of muscle decline is about 1% a year after perimenopause. And so you do the math, 10 years out, you're going to be down 10% on your muscle mass. And here's a little test, estrogen depletion, yes. Here's a muscle test that you can do, and I'm going to share some other tests if you wonder how much your hormone or your muscle loss has been. There is, and I did the teaser video. You can go back and look at it. I'm kind of silly sitting in my chair by my Christmas tree. But you can get up and down out of a chair. So stand up, sit down, stand up, sit down. And you should be able to do that 5 times within 10 seconds without using the side rails on your chair. And that will tell you if you've lost muscle mass. And there's also, I'll just jump into that. There's also scales. So you can do the impedance scales. I've done research and it's sort of hit or miss what I've been able to find about the accuracy, but I do it. It seems pretty accurate. So times when I have lost weight or gained weight, it actually will tell you your bone density and it will tell you your body water. And so I think it's pretty accurate. So, okay. And then there's other things too, and we'll talk about that in just a minute. Okay. It reduces muscle protein breakdown. It actually has a mechanism to reduce muscle protein breakdown. So you want to be able to build and you want to prevent breakdown. And it supports something called mitochondrial function. And the mitochondria is the powerhouse of the cell that's down there in the DNA, all the like nerdy science where your cell literally breathes and creates its energy. And every cell in your body has that cytoplasm and mitochondria in the cell. And that's where you make your energy. They call that ATP. That's where you make your energy. So it supports that mitochondrial function. And now can you see that if you don't have estrogen, you're going to start to lose the power in your cells and you are literally start dying. And that's why we call it apoptosis or senescent cells. They are renegade cells that can cause cancer. If you don't have the ability to break down that are going nutso, you are going to keep making cells that are going to become cancer. So it is completely opposite of what you've been told, unless it's synthetic high dose estrogen, unopposed without progesterone or the other, right? Because your ovaries are very complex and they have a lot of hormones. So, okay. It enhances stem cells. What the heck are stem cells? You've probably heard that. Stem cells are cells that come out of your bone marrow that can become anything. Blood vessels, nerves. We do PRP in our office. So it's platelet-rich plasma, which has a high concentration of your stem cells that come into your bloodstream. And it repairs tendons, ligaments, joints. I mean, there's pretty much nowhere on the body. I haven't injected stem cells except the eye. I've done gums. Everywhere. We do it for incontinence. So to increase your body's stem cells, to make stem cells, you have to have estrogen. Now, here's the deal. People say, well, you're an ovarian failure. You have no estrogen anymore. And I'll tell you, if I don't take my hormones, within 5 days, my estrogen levels will drop to 0 again. And you do have little glands on your kidneys called the adrenals that make estrogen, progesterone, testosterone, cortisol, DHEA. But the problem is these chemicals that we're exposed to are called endocrine disruptors that actually mess with all of that. So people are like, well, why are we having so much problem with ovarian failure? And it was never this bad before. One is that we have false information. And so women aren't getting help. And, the other thing is that these chemical disruptors are affecting everything. So, okay. So stem cells, we need new stem cells. Super, super important. Okay. Increase collagen synthesis. What is collagen? You've probably heard of collagen powder. Collagen is the matrix of the tissues that surround the muscles. So if you need that collagen to actually promote new muscle cells, promote the tissues around it, the tendons, the ligaments, all the things, basically. Oh, and I will say a little plug for powder. I research all this stuff, and when I formulate stuff, I always make sure it's like the best of the best. So if you go to the link in bio, there's a link tree, and you can go to our shop. You can go shop there, and our collagen powder is amazing. And it helps with skin because it's like all the matrix of skin, muscle, all the things. So it's pretty cool. And estrogen helps with blood flow and getting oxygen into cells. And we all know that your muscle is very, very dependent on getting oxygen to it, right? which is one of the reasons that interval training, or what I call burst training with high intensity, is really good for muscle because, oh, Constantine says, is it vegan? Yes, it is. No, it's not. I should know that. Oh my gosh. Bovine. I'm sorry. It is cow. So sorry. I should probably carry one that's vegan though. My bad on that. So yeah, so I got distracted. Squirrel. um, so yeah, absolutely. So blood flow is really important to the muscles, and collagen helps with all the things, right? To help build stuff and with skin. And I really notice a difference when I don't take my collagen. So that's a really big deal. Okay. And decreases inflammation. So I love to share how it decreases inflammation, because this is so cool. Hold tight. Okay. Your where the liver comes in. Oh, honey, you're okay. Constantine says, didn't mean to interrupt. But if I don't see your questions, just bring it back around and I'll see it when I get to it in a minute. Okay. So your liver makes something called cholesterol. So cholesterol is not a fatty globule ready to cause a heart attack or a stroke. It is not. It is a hormone. It is a hormone, which is a steroid hormone, just like your estrogen, progesterone, testosterone, all those. And it has a very important function. So I will say there, I'm not even going to go there. Okay, it has a very important function. And cholesterol turns into your progesterone through enzymes. Progesterone, can't spell tonight. And then that turns into estrogen. And I say estrogens because there are different types. And somebody actually put in the comments a while ago, estrone. So we call that E1, E2, and E3. So estrone is the problematic estrogen. And I'll save that for a whole nother night because that's a whole talk for an hour. But estradiol is the one that helps with your bones and your muscles and prevents stuff. And E3 is a protective one that actually goes and tells estrone to get out of the way and behave. So it's actually protective. And I have had active breast cancer that I very comfortably put them on estriol. So when someone says, I can't take estrogen because I have XYZ, estriol is God's most important gift to you because it binds up the receptors of the estrone and can actually prevent, which is information that I think every woman should know. But again, that's another conversation. Estrogen turns into testosterone. So why did I do this when I said inflammation? Because there's another side pathway that makes cortisol. And if you've ever had a cortisone shot, cortisol is your body's natural anti-inflammatory. I always say it's God's ibuprofen. So cortisol is your anti-inflammatory. So if you're having if your ovaries are gone, you can't fight inflammation anymore, and you start getting aches and pains, and inflammation is everywhere in your body. And that's why you can't do the chair test. Besides losing muscle mass, you're inflamed all over. So now you've got fibromyalgia. It's just, you gain weight, you get cortisol belly. I mean, it's all the things that we contribute to. They call it infla-aging, like inflammation and aging. And your cells, the DNA have these little things called end caps or telomeres on them. Inflammation literally unravels those like a shoestring. So those end caps are like the little plastic ends on a shoestring. So inflammation will literally unravel your DNA, that little double-stranded thing, like a frayed shoestring. And when you have a frayed shoestring, you can't put it through the little hole in your shoe. So it's bad. And that's what aging is. So that's what they call infla-aging. Correlation between low estrogen and severe GERD. There absolutely is. And while we're talking about muscle, there is a muscle called a sphincter at the bottom part of your esophagus. And as you lose muscle mass, you lose muscle in sphincters. So you lose muscle in that esophageal sphincter. And if that esophageal sphincter is not working properly, where does the acid go? Right up here. And now you have GERD or reflux and acid in your esophagus. So muscles aren't just about, hey, I'm looking buff, I look good. Muscle is in your sphincters, in your rectal sphincter. Who wants to have rectal incontinence? That's awful. Who wants to have um, bladder incontinence because there's sphincters there. I mean, there's sphincters around your gallbladder. I mean, everywhere there is muscle that you're not even thinking about. And so, yeah, I mean, it's like not only about your risk of falls and not only about your risk of all the cosmetic things that you don't like, but on so many levels, losing muscle is everywhere. Muscle does lots of things. And muscle is in your artery walls. That's how your arteries pump stuff through because there's smooth muscle in the lining of the arteries, and that's what pushes the blood through. Now, your heart beating, yes, but like in your lower extremities, that's why we get atherosclerosis, or that's a mouthful, atherosclerosis, because you have the blood goes down and the muscles bring it back up. And so when you lose muscle, hardening of the arteries and the extremities, and that's when you have your blood pressure, you have your top blood pressure and your bottom number, your systolic and diastolic, and then your diastolic is can be okay for a while, but the top number, the systolic, goes up. So because you're not having that pump, because those little valves in your leg actually push the blood, or the muscles push the blood back up because the valves keep it going one way through the arteries and then back up through the veins, and you'll get varicose veins. And if you get varicose veins in your legs, that's bad. It affects your circulation because now you start to get neuropathy. So your muscles are very, very important. Okay, I think you got that idea. Okay, so I'm going to go through a few of these things because I know we're coming up pretty soon on the hour. So go ahead and please put your comments or your questions in. I'm just going to kind of go through my notes. I want to make sure that I talk about all the important things. So we did talk about oxygen delivery and inflammation, and also there in your muscle, there's two different kinds of muscle. So I was talking about the smooth muscle in your arteries. Your skeletal muscle are the big muscles. So whether you're losing smooth muscle or skeletal muscle, you're losing all of it. And you actually have smooth muscle in your gut. So what does peristalsis and your digestion is that smooth muscle in your gut. So constipation is one of the main things that I see in women after menopause, and women love me. They tell me that if you did nothing else for me besides my hormones, I feel better. Magnesium actually helps the smooth muscles in your blood vessels, but in your gut. So if you have constipation, you need that smooth muscle contraction and relaxation to move food through. So magnesium, if you have muscle spasms or any trouble with muscles. And okay, this is crazy. Tums, if you ever have like menstrual cramps or anything like that, or muscle cramps, Tums is really helpful. So I always try to share those little things with you. Okay. Oh, and your diaphragm's a muscle. So as you lose your diaphragm control, you're more prone to, well, to reflux for sure, but you're more prone to different, so stomach problems, so all sorts of things. So, okay. And then let's see, we got, okay, the rate of muscle loss, I don't know if I said this a while ago, but it's about 1% a year. So the first 5 to 10 years is the most muscle mass loss that you're going to have. And then, so some of the reasons that you lose muscle is, of course, estrogen, of course, testosterone. I think this is fascinating when it comes to testosterone. And again, we'll do another whole talk on testosterone some night, but I have a friend who's 5'11", just like me. Yeah, I'm super tall. I'm like giant girl. He was not overweight, and I'm not overweight. I was talking to him one day, and I said, okay, we both weigh the same, like 140. Or no, I'm sorry. I'm 140, and he was like 185, 190, and we're both the same height. That difference is muscle. So testosterone, men have a lot more testosterone than women. So the idea that muscle mass weighs more, and I always tell people when they're trying to lose weight, muscle really does weigh more. So if you're doing strength training, super important to remember that. But muscle's everything. So testosterone and muscle has a direct correlation. So that's really important. Also, if you don't use it, you lose it. I always think of the mind as a muscle too. If you don't use it, you have to stay really active. And I'm like constantly doing nerdy research. So keep your brain active too. So reduced activity levels, if you don't use it, you lose it. So stay active. And even if you're not going to strength train, it's just so, so important to stay active. And the problem with that is the risk of falls and losing your independence. That sucks. That's one of the main things you see in nursing homes. So I'm going to show you this crazy thing, my pizza plate. It's not pizza. Actually, there's a video in my on my homepage, and I talk about this thing a little bit. But yeah, it looks like a pizza plate, and it's kind of got like you could file your nails on this thing. But basically, it's a balance board. And my disclaimer is that be careful. You can get this on Amazon for like 25 bucks. And this is just amazing. The first time I got on this, oh yeah, testosterone, BHRT. Yeah, we absolutely do that too. So important. The first time I got on this, I thought I was going to break my freaking neck. I mean, I was like, and my trainer, I have one of my dear friends is a trainer, and she was like, introduced me to this, and she was like, be careful when you get on this thing. And I was like, okay. I mean, it's just a little balance board. How hard could it be? And I was just like jello legs. I mean, it's just like muscle spasms all through my legs. And so, like, I really had to hold on to something until I got used to it. And why am I telling you this? Because it builds muscle in the legs, and the leg muscles are your largest muscle mass. So if you want to burn fat or dietary fat, that's what your muscles like to do, is burn dietary fat more than sugar. So if you want to lose weight, focus on the muscles in the legs. And this actually helps with core strength, because to be able to balance on this, your center has to be really strong. And so that's why I realized that my core was not strong. And I do crunches and stuff like that. And I will tell you, don't think that I am like crazy exerciser. I exercise Monday through Friday, and I exercise for less than 20 minutes. So, and this is included. This is really important. I do this every day, because that core strength is what will help you from falling and breaking bones. Because that old commercial we used to see, I've fallen and I can't get up. That is terrifying. And I saw my mom and my grandma go through falls and stuff, and it's awful. So we don't want that. Okay. Get you some little 5-pound dumbbells, super cheap, probably 10, 15 bucks at Walmart, and just do some bicep curls, or you can do crunches. Or sometimes I'll even I've worked my way up to where I can do that little balance board now, and I'll do squats on there and use my weights and stuff, but that takes a while to get up to there. One of the best ways is your exercise bands. You would know that all my stuff's pink and purple, right? such a girl. All things girl. Barbie, love Barbie. So these are so good for muscle, and you don't have to have expensive weights. You can get these for less than probably $7 on Amazon. So Elaine, yeah, I'm yeah, all girl. So these are super easy. You can just Google exercises, and there's so many things on my link tree. If you go there, I have a couple of like my balancing act book, and I literally have exercises in there that you can do. So, okay. And if you do our Hormone Bliss program, which is in the link tree too, our hormone experts work with you and build plans for you. But I always say, don't worry about diet and exercise. Just get on some freaking hormones and get feeling better. And then we can have the conversation about all the things we can do to get you where you want to be. And I hate it when women say, I just want to feel better, because I'm like, but that's not that they want to feel better. They'll say things like, I don't expect to be all thin and healthy. And I'm like, you should expect that, because once you get feeling better, the next step is you're like, hey, wait a minute. I feel like I'm 30 again. What can I do? What can I do to take this to the next step? So I love it. Okay. So this is an ankle weight. And I should do this again. I don't know why I don't, but I do this when I work out, because it increases the weight on your legs and your muscles and stuff. So you can do it on your ankles or wrists. And I should just walk around the house all the time with that, right? Okay. So let's talk about risk of diabetes. So you actually, the term is called sarcopenia, which is muscle loss. And because muscle actually plays a role in your sugar metabolism, you have a higher risk of diabetes, because your muscles want to burn fats, dietary fats, your oils and things like that. When it is forced to burn sugar, that's not what it prefers. It wants the fats. And so as you start making it work with sugar, the whole metabolism loop gets thrown off. So diabetes is a real thing. Emotional and psychological effects. Well, one thing is if you got bat wings, you're not going to feel good about yourself, you know? And so the other thing is that when you exercise, the blood flow and the endorphins. So endorphins are chemicals that are released from the muscles that actually help you feel better. And there's so many studies to show that it relieves depression, things like that. My moderator, my fiance, wonderful, actually studied exercise physiology for years. And so give me a thumbs up, baby, if I'm telling the truth here. But so I think it's just fascinating that people who study muscle stuff are just, they get it and they know all the implications and ramifications. So resistance training, we talked about that. Okay, let's talk about nutrition and what I focus on. He says, yay. So I guess I'm on the right track. Hi, Susie Q. Nice to see you here, honey. Okay, so nutrients. I like to tell women, and this is such a relief for a lot of women, don't worry about carbs. I said it. Don't worry about carbs. Worry about protein. And the thing is, yes, carbs are, high glucose concentrated diets are bad. We won't even go to all the reasons. I know that's bad. But if you're focused on protein actually helps you build muscle. So it's very important. And if you're eating a lot, hi, Disa, if you're eating a lot of protein, you're not going to have a lot of room for dessert. So we have Christmas coming up, right? So focus on the turkey, focus on the ham, focus on the deviled eggs, maybe a little fiber, your salads, your greens, all that kind of stuff. And then by the time you get to dessert, you're probably not going to want that much. So focus on the protein. How much protein should you have? If you're taking notes, oh, thank you, Adri. That's so sweet. If you're focused on protein, you need to think about your protein and getting about a gram per pound of body weight. And it is like unbelievable how little protein we get, right? Especially for a carb heavy diet. And so one protein shake, this is our detox powder. I love it because it helps with methylation in the liver and everything. But it has about, I actually forget. I use it as my protein powder every day. It has about 15 grams of protein in it. So 2 of these a day, I get 30 grams of protein. And then if, I weigh about 140, 145. So I need about 145 grams of protein a day. So I really have to focus on that. And do I get that? Probably not. But that's the recommendation. So I'm just saying, if you're only getting about 30 grams of protein, you really probably should be doing some kind of protein shake. And we have protein shakes, but I do the detox because it's all things liver. But there are some that have 25 to 30 grams of protein. So that's probably if you want to get your protein up fast, that's probably what you need to do. Okay, so hormone, vitamin D, we talked about that already, right? Balance training, we talked about the balance board. So Tai Chi or yoga can help with that. And let's talk about some other ways. I know I'm about out of time, but how can you tell if you've lost muscle mass? So I started out the talk about talking about how many times you get up and down and out of a chair. So if you can do 5 up and downs out of a chair without holding the arms in 10 seconds, you're probably doing pretty well with your muscle mass. Walking across the house. Now, I don't know how big your house is, but if you have a average size bedroom, average size living room, average size dining room or kitchen, can you walk across the house within 10 seconds? That's a good way to tell. Now, if you have lung function problems or, you're out of breath or overweight, all that contributes. But if you're relatively healthy, you should be able to make your jaunt across the house to answer a ringing phone. Oh my gosh. Remember when we had the wall phones in the kitchen and you had to run before it stopped ringing? So yeah, so you should be able to do that. You can do DEXA scans. You can do, they have this thing that you can do hand grip. I don't know about that because some people get arthritis and inflammation. So I don't know if that's really a measurement of good muscle mass. My fiance could probably weigh in on that, more about muscle than me, but that is one test they say. And then, yeah, so there's bioimpedance and all the things. And again, you can get one of those scales too. So a few other reasons before we have to bid adieu. Muscle is your metabolic engine. So if you want to lose weight, you got to have a good muscle mass. Estrogen helps with muscle recovery. This is cool because with muscle, if you're working out and you get sore, you can use something called glutamine, and it is an amino acid, and it will help that muscle recovery. Also, there's creatine, which a lot of people do when they're working out. It helps get more water in the cells. And so there's so many different supplements and things you can take, but high protein is the biggest thing. Testosterone is super important, and doctors make women think you don't need testosterone, but you absolutely do for lots, definitely with muscle. And then your joints can hurt if you don't have good muscle tone. When I have people come in and they have joint pain or bad knees and they're overweight, we focus on muscle and tendons. So I talk to them about estrogen because all of that's related. But if you don't have strong muscles, your joints are going to hurt because they're going to cave under the pressure. Liver health, we talked about that just a little bit. Bone density to link to that because that's all connected too. Oh my gosh, we could talk totally about, because that's really important for the balance of all things metabolism. And your skin is a muscle indicator. It's the canary in the coal mine I always talk about. And a couple other things, omega fatty acids, L-carnitine, lots of different supplements. And some people ask me how much testosterone, and a lot of doctors, if they do testosterone, they either overdose with pellets or they underdose with creams or shots or anything like that. So just something to keep in mind there. So I do want to tell you our hormone kits. It's a kit to order, and the link is in our bio, or go to Hormone Bliss. Oh yeah, I love lysine too. Lysine's good for fever blisters too. Thank you for sharing that. I'm not sure how to say your name. Ladience. That's a cool name. Okay. So yeah, so you go to the link in bio, and it's Hormone Bliss is the site, and get your kit. It's a saliva home lab test. You send it in the mailer. That's included. Lady knits. Oh, that's pretty. I like that. Okay. And then you send it in, and it's all included, but our hormone experts will get on the phone with you and talk about a plan to get you on bioidentical hormones. And even if you're still scared of estrogen after my passionate rant, then testosterone might be something for you. Order it while vacationing outside of the US. I'm not sure if our site that does the shipping will go outside the US. It kind of depends, because some places, like I have a patient who is in Honduras, and she has it sent to Costa Rica. Yeah, I'm not sure. Probably the good thing to do is if you live in the US, you're in Costa Rica. Oh, you're going back home. I probably, when you're back home, load up, and our hormone experts, they work with you, our coaches, they'll help you like make sure. And they'll do it so that you can have a letter that says this is medically necessary. And so you can travel with it, right, in your carry-on and stuff. And also, if you have an HSA or FSA plan, that will cover everything too. And this is a good time of year. So if you're about to run out on your plan, use it or lose it kind of thing, definitely do it before New Year's Eve, right? Because you don't want to lose it. And then when is the sale? So the sale for the $119, and the kit's usually $300, but the sale is $119. Oh, I'm losing my thing. They're saying it. Hang on just a second. They're wanting to kick me off. I am not ready yet because I love my people and I want to hang out more. But yes, $dollars for till our Christmas sale, and I'll probably run something else after that, but I don't know what it's going to be. So it'll probably be a little higher. I don't know. kind of talked about it back and forth because I want to make it super affordable. But if you were to do testing, if you could even get a doctor to do it, right? I mean, that's just gross that you have to beg a doctor to test your hormones. It's crazy. But I mean, it could be $400 or $500. So yeah, so it's pretty cheap, and it's a great stocking stuffer. It's probably a little late to get it before Christmas. I mean, if you ordered it tonight, it probably go out tomorrow, so it could get to the stockings in time. But yeah, till December 25th. But we are probably going to do a New Year's special because that's a whole nother thing. Because people want to get healthy for 2025. So don't panic if you can't get it in before then. But yeah, so do that. I love you guys very much. Thank you for being here. I think it's so important that you guys know the truth and don't ever take anybody's word. I have a lady one time, and she was on, I mean, this happens all the time, but she was like, why are you telling people that hormones don't cause cancer? And I'm like, oh my gosh, okay, where do I even start with that? And so all I said was, why do you think that? And she commented back, because my doctor said so. That is where people get into trouble. When you blindly believe and you don't even have to do research. You just have to like ask the question. I mean, go on, Google it, Chat GPT, whatever you got to do, but find the truth, and it is there, I promise. And so that is my mission, is to be the truth and to shed light on the darkness, and you do not have to suffer. Okay. They're totally going to kick me off because I will just stay here and just love on you guys all night. But okay, gotta go. But I'll be back here tomorrow night at 7 o'clock. So please tell your friends and go look at all my videos. I'm on YouTube, Dr. Tammy Tucker. I have years and years and years of videos, and I'm on Facebook, Dr. Tammy on Facebook. So find me there. Lots of resources. And Susie Q, you have a great night too, sweetheart. And y'all just, I know y'all getting ready for Christmas and all the things. So have fun, and I'll see you tomorrow night.